Hi, I'm Dr. Dave Novatnak. I'm from Doctors Choice Physical Medicine and Rehab in Pottsville, Pennsylvania, and we're going to talk about the difference between a lumbar strain and a lumbar sprain.
Hi, Dr. Dave. Can you explain to me what the difference between a back strain and a back sprain is?
Sure. A back sprain involves a joint. A back strain is all about the muscle. The joint isn't involved.
Most people report I didn't do anything to cause back pain. Why is that?
Well, most of the time people have a problem with their back or their locomotion system to start with. By the locomotion system, I mean how they walk and how they move. So there could be problems with short muscles, tight muscles, weak muscles. And when they do that one certain little movement, something they've done thousands of times before, their back sprains. That means they hurt the joint. Okay?
Do people sprain their backs because their muscles are weak?
Not necessarily. When they sprain their backs, typically what we see is that it's an unsupported motion that they've done. They're doing something that they've done thousands of times before. They do a movement, and their back muscles don't support that movement anymore. Typically, they have a problem, and they have a compensation in their system. And when they make that movement, that compensation system can no longer compensate, and that's what causes a sprain.
How do you diagnose a low back sprain?
Well, there's different ways, but to make it real easy with you, if we want to diagnose a sprain from a strain, just think of my elbow as a joint in your spine. If I want to look at a joint, I got to move the joint. Okay? So if that hurts, more than likely we got a sprain. So to differentiate it, I'm going to ask the person to make a muscle here. I'm going to push against it without any movement. They're resisting me. And if that hurts, then there's a muscle strain there also. Okay? But if we just get pain with the muscle with not too much movement, that's a whole different thing.
What's the best treatment for a back sprain?
Well, it depends on how bad the sprain is. Okay? So again, with a sprain, we're talking about joints. Okay? So let's look at this knee and think of this as a spinal joint. So this is a ligament right here. So ligaments work by stretching a little bit, allowing some movement, but stopping all movement. So I don't know if you can see that movement in that joint pretty good. So there's different degrees of sprains. So if we could think of this as being that ligament, so when we're moving, it's allowing some of that movement, but I also can't go all the way with it. So when we get a sprain could be just maybe a 5-degree sprain. So it's still pretty much working like normal, so you might be a little sore with this, but an injury like this, typically you're not going to end up at the doctor's office. But a grade 2 sprain is anything more from 5% to 95%, and that'd be something like this. And when we sprain a joint like this, you can see that that ligament just doesn't work the same way anymore. There's no support there. So the first thing you want to do when you get a sprain is the same thing you do for an ankle sprain. You want to put ice on it, reduce the swelling, and decrease the blood flow. So you want to put just ice in a plastic bag and put it directly right on the area that you sprained for about 7 minutes, maybe once every hour. After that, if that doesn't start to feel better, you have a more serious type of sprain, and other treatments may be necessary. A 3rd-degree sprain is a sprain that's all the way through that ligament, so it's in 2 different pieces. Those type of sprains require surgery.
So can a back strain lead to other problems?
Oh, absolutely. A lot of times people come in here, they have a sprained back, and they start to feel better in a couple of weeks. But the thing is that their body starts to compensate again. So they're going back to the point right towards they were right before they hurt themselves. And actually, when you get a sprain like this is your chance to correct all those postural problems and movement problems, so you get a better recovery and you take the strain off the area that you hurt. So you get a better recovery, and in the future you won't have as many problems. If you don't take care of it, typically that area is just going to degenerate and get weaker and weaker and weaker, and next time you're going to sprain your back, it's going to be a lot worse than it was the first time.
Okay, so if I sprain my back, I use ice, I do a little rest, then what should I do?
Well, if it's still hurting the next day as much as it was the first day, or it's just not going away after a couple of days, I would encourage you to call our office and let's take a look at it, because it's possible it could be more than just a simple sprain. You may have some disc problems going on with your back injury. That's going to need a lot more special care than just the ice to keep the swelling down until the tissues recover. So I would encourage you that if you're still having problems like this, give our office a call. That's Doctor's Choice Physical Medicine and Rehab in Pottsville.